Okay. Right now, there are more than 1,000 vaping-related lung injuries. About 27 people have died in what people are calling this country's vaping crisis. Greg Conley is here to discuss and take your questions right now. We're streaming live on Facebook and on YouTube for this Friday evening. I'm Elliot Francis. Thank you for joining us. Well, something very mysterious and dangerous is happening in the lungs of vapors across the country. It's killing young people and old folks. It has plenty of scapegoats, but right now nobody really knows what's going on, who's to blame. And it's leaving a lot of questions and very few answers. Hopefully our guest this evening can help provide some of those answers. Greg Conley joins us. He's the president of the American Vaping Association. He joins us from his office in New Jersey this evening. Greg, thank you for joining us.
Thanks for having me.
Let's talk most immediately for a second about what's front and center in the news and something we just talked about. There are, last time I looked, we've got bans. E-cigarette bans in Michigan and New York. Massachusetts has a complete ban, but right now the industry is kind of waiting for this complete and total flavor ban across the country. Explain, please, and tell me a little bit about that.
So yeah, we're dealing with two really big issues at the moment that each deserve a lot more attention than they're getting, which is first the lung illnesses, which we'll discuss later, but also the fact that on September 11th, President Trump announced his support of what is essentially what amounts to a flavor ban on nicotine vaping products sold all across this country, including in 10 to 14,000 small retail shops that rely on these products to survive. And the general idea is that before this, applications to the FDA, potentially multi-million-dollar applications seeking permission to keep vaping products on the market, those were going to be due in 2020, May of 2020. Mm-hmm. And now, under what the Trump administration and his HHS wants to do, they want to roll that back immediately and say, unless we approve these applications, unless you spend these millions of dollars, you cannot continue to market your products, and that's going to be devastating.
Yeah, that is going to be devastating for most of the people, many people who've been vaping for over 10 years now. Many people dealing with this issue and wondering if their local vape shop is going to go away, and we certainly hope not. Let me just remind the viewer, we are taking your phone calls and your questions this evening. This is a Q&A session. So we want you to call us. Greg is here. He's given his time, which is very valuable. This guy is wanted, dead or alive, across the country right now. He is very much in demand, and we thank him for joining us tonight and giving up his time. But he is here to take your questions, either by chat or by phone at 443-505-7560, 443-505-7560. We have a bunch of phone lines open right now. Call us. Take advantage of this time with Greg here, and get your vaping questions in. Any things that you've been worried about for the past month or so, now's the time to call in. Greg, before we go any further, I wanted to talk a little bit about this Mayo study, because it seems to have, Mayo Clinic study, it seems to have confused a few things. And for those who aren't familiar, and just to bring you up to speed on what's been going on for the last, I don't know, 2 weeks or so, take a look at this. This is from CBS and ABC News.
A new study by the Mayo Clinic is the first to look at the biopsies of lung tissue from vaping patients. The common denominator among all the patients was what appeared to be a toxic chemical injury.
This is similar to what happened when a person is exposed to toxic fumes. It's like, we call, basically the term is chemical burn. So it's like you put fire inside your lungs.
Dr. Isabel Mira is one of the researchers who conducted the study. She says vaping is more dangerous than cigarettes.
We don't see that kind of findings in regular smoking.
She says it's like putting poison into your lungs.
With this evidence so far, I mean, I will really say, don't do it. I mean, especially protect the young kids.
Now she'll be working to see exactly which ingredient, mixture, or brand is causing those chemical burns.
The medical community is scrambling to zero in on the exact cause of the vaping-related disease. Now, we talked to the head of Mayo Clinic's Nicotine Dependence Center about what we know so far.
As you point out, many bans of substances haven't worked. So my guess is that the best approach, which is the longer view, is better regulation.
Dr. Taylor Hayes say they know that aerosol chemicals in e-cigarettes are less harmful than what's actually found in tobacco cigarettes. But there's also early evidence that e-cigs might help smokers quit, and they worked almost as well as the nicotine patch.
If we could get all smokers to completely stop tobacco and move over to a reputably manufactured e-cigarette, I'd probably take that trade, because I think it would significantly reduce the death and disease we see from tobacco, which causes about 500,000 deaths per year in the U.S.
What's changed about vaping recently is likely related to the illnesses, and people are vaping many different products, including THC. The Mayo Clinic looked at lungs of people with vaping-related lung disease. They found a toxic chemical causing inflammation, resulting in lung disease. Until there is safe regulation, doctors say no one should start vaping and always avoid black market products.
Okay, so we tried to get both sides of that issue there between those two reports, CBS and ABC. But the Mayo study, if I recall correctly, took biopsies of a small group of people, tried to determine what it was that was impacting the lungs, and what they found, essentially, what they came back with, was that it was just being impacted by some toxic chemicals, but not much else. The other conclusion that we have seen, and tell me if I'm wrong here, is that at least, and this was borne out since the last time we talked, at least 3/4 of the patients who are now being treated, and some of the people who have died, reported that they were vaping with THC products. So that's something we'll talk about in a second. But with the chemical burns that they were saying, it doesn't seem to me, and tell me if I'm wrong, that the Mayo Clinic really came to any conclusion that is helping the situation any. Yes? No?
No. First, it was nice to see the Mayo Clinic actually go on national news. And
Now,
say
a new
the truth,
study by the...
which is the truth, which is that if we could get every American smoker to switch to vaping, that would be a great benefit to public health. But the fact is that the Mayo Clinic study is hardly definitive right now. Some of the doctors who have diagnosed patients with lipoid pneumonia, they have stated some criticisms of the article. But what the article really does point to is, again, we are looking at a contaminant that's found in some new generation of products. And in the Mayo study, 12 of the patients of, I believe, 17 had admitted to using THC products. What the CDC is now reporting is that just only 13% of the patients across the country are saying that they only vape nicotine, just 13%. And we know from CDC publications in Wisconsin, 8 of the patients initially stated, I only vape nicotine. Well, the CDC, through further study, through interviews with their friends, with their family, with them, they actually determined that 5 of the 8 definitively had also vaped THC. So you are dealing with a problem with patients self-reporting data, not using urinary testing, that people are saying nicotine only, and it's taking several weeks to discover that maybe they aren't telling the truth in each individual case.
Gotcha. Got a couple of questions coming in here through social. Let's see if we can bring this up on the screen here. Bobby Heller says, yes, there are convenience stores selling them to teens, and I have video proof of it. Have turned it over to authorities before and really getting nothing back. Another person, Wes Jade. Let's see if we can bring Wes Jade in. Nope. Okay. We'll bring that back in a second. Hold on a second. Wes Jade says, yes, there are convenience stores selling it. Nope, we'll bring that in. Let me just read this off to you. Wes Jade wants to know why does the government not mention that the FDA did a study on flavors in regards to nicotine gum, and it showed it had no link to youth. Does that ring a bell at all? I'll read that again to you.
Yes,
What?
the
Go on.
study indicated that adding flavors to nicotine gum did not raise abuse potential, and it didn't raise new concerns about youth deciding to start using nicotine through the gum. That study is one of many that says that that indicates youth use nicotine products more than just because there are flavors. That study is not, again, definitive by any means, but you can add it to a large body of research that proves that these products, all together with the population level, are causing a significant public health benefit.
Yeah, Mark comes in on chat and says what phone number to call. Here you go, Mark, right here. Look at the bottom of the screen. 443-505-7560. 443-505-7560. Call right now. We'll get you in touch with Greg. We'll get your phone your phone call right on the air right away, and see if we can get your question to Greg, and so we can answer this question. We were just talking a minute ago about the 3/4 of the people who have been sickened by whatever it is, reported vaping THC products. What about the other third? The other third still come in as people who vaped nicotine products. What are you hearing about why that may be? Is that have to do with black market products as well?
Sure. So it's important people know out there that when we're talking about THC, by and large, we are discussing illicit THC products. There have been about 3 cases between Oregon and Washington where patients have reported only purchasing marijuana oils in legal dispensaries. But you're looking at hundreds of other illnesses, all linked to illicit THC products. Nevada, for example, with legal marijuana, and many stores and many people using the products, there are all of 3 cases in Nevada with 0 linkage to legal marijuana products. Also, Utah, just this week, Utah released data actually about 10 days ago, where of 36 cases, 34 patients, 94% of them admitted to vaping illicit THC products. That's the concern. As for, according to the CDC data released earlier today or yesterday, 13% are saying that they only vape nicotine. Not a third, but only 13%. And as we mentioned earlier, there are not just CDC case studies, but also journalists and health department officials that have gotten quotes from people saying, yeah, I treated a patient, a doctor saying, I treated a patient and he swore up and down that he was not vaping THC, and it was only when his parents searched his room that they found it. THC remains illegal, and in many places in this country, there's a societal negativity attached to it. And so that makes sense that there are people that are not being truthful about what they were vaping.
Yeah, that always makes sense.
Every single case has somebody being not truthful, but they're really the doctors who have reviewed these cases that have been studying nicotine vaping products for 10 plus years. They've said that there really is no plausible biological, toxicological reason for nicotine vaping products to only be causing illnesses like this in America and not in the UK, in Russia, in Asia, everywhere else that these products are being used in large numbers.
Yeah, that's the crazy thing. We find that over and over again. We're hearing from people who are saying, well, that's happening in the U.S., but over here in the U.K. or in Germany or elsewhere, we just have no problem. And that just seems like such a strange thing. We'll talk about that more in a second. We do have a caller. Let's see. On the line, Cody. Cody is calling from Moore Park, California. Cody, you're on now. Hi, what's your comment? Hello, Cody?
This is Mark, actually.
I'm sorry, Mark. Mark, you're calling from Thousand Oaks, California. Thanks for joining us. You're on now.
Hi, Mark.
Thank you so much. Thank you so much, Greg, for all of your hard work and for representing the industry so well. And thank you so much for having this show, for the information to be shared. And my question on topic of what you guys were just discussing is, and wanted to get your explanation of, why we're not seeing this in places like Europe. And I've heard things said that, it has to do with the nicotine levels as opposed to the flavors, and why the kids there aren't being attracted to it the way they are in the U.S.
So there's two different issues there. Nicotine levels aren't a function of lung illness by anyone's real account. The high nicotine levels do cause risk-seeking youth to use the products to obtain a head high. That's one of the issues with Juul. It is a wonderful product for getting heavy smokers off of cigarettes, but youth that use a 5% nicotine product, if they take a couple puffs in succession, they generate a head high, and that's one of the things that attracts them to products like Juul. But as for what's happening in other countries, I think the United States is really one of the only large countries certainly one of the only large countries where you have such liberal marijuana laws happening across the country and acceptance of marijuana, but also the THC oils. I don't think, even if you're if you go over to the United Kingdom or Germany, I think you'll have to search pretty hard to find those THC oil cartridges. But here in America, once they're available in a legal market, and once somebody goes to Colorado or Washington and California, goes to a pot store and sees that they can vape marijuana without any real smell, they want to go back to their legal state and access it as well. That's really what is happening. It's driving a black market problem. The people want to get these products and they can't get them legally.
Mm-hmm. All right, Mark. Yeah, Mark, thank you. Thank you very much for that phone call. Let's see. We have another call here from, let me just make sure I get it right this time. This is Cody. He's calling from Moorpark, California. Cody, you're on now.
Hello. I just wanted to ask a question, what your opinion is on this. This industry's been around for about 15 years or so. I've been using these products for upwards of 10 years now. Why is it that the CDC, the FDA think that this is a problem only now in such a short amount of time when this industry's been around for such a long time?
So yeah, it absolutely is a problem right now. But the fact is that these products have been widely used for at least 10 years. Yes, they came here probably 2007, but really 2009 is when people began using them and switching to them in good numbers. And it hasn't happened before now. There are researchers that have gone back in their archives and maybe found some case 5-6 years ago, individual cases, but you never saw tens, let alone hundreds and more than 1,000 illnesses before these black market THC products really gained prominence. And it's been particularly amazing to watch Los Angeles County, California. Los Angeles County is the epicenter of all this. You can go to Skid Row tomorrow and you can pay for admission to places where you can not only buy fake packaging and blank cartridges, but the THC oil as well. And Los Angeles County, as well as California law enforcement, continues to do nothing about this problem. And that's one of the reasons why I don't think that these illnesses are going to stop anytime soon.
Cody, Cody, thank you very much. You brought up a good point, and one that I wanted to explore, because I saw something earlier this week, and it stunned me that there was a facility in the middle of the San Fernando Valley, Canoga Park area. I know it well because we used to live there for many years. And it was a huge facility with, they had food, they had music going on in the background. It looked like a big party. And of course, they had all these vape cartridges laid out for people to buy in bulk, obviously to sell somewhere else. I am shocked that this happens in a state where it's legal on both sides. What's happening there?
So in California, taxes as well as location bans have driven black market sales. Even if you live in an area of California that has not taken county-wide restrictions on banning the opening of marijuana stores as well as marijuana delivery services, if you are a low to middle income person, you do not want to be spending more money than you have to for your marijuana. And so it's one thing to purchase your marijuana from the black market when it's leaf marijuana to save money. People have been doing that for decades and centuries. But the black market THC oils, meanwhile, those, because they are not just a leaf, there are other chemicals involved. Those are the ones. And it's odd about California is, yes, they have tax revenue to protect. Yes, they have a legal market to protect. But it has become so accepted. No one wants to be the bad guy saying that maybe some element of this is a problem. I think that it's much more fashionable and much more easy for an elected official or a police officer to talk about nicotine vaping products, which most of the country has a problem with at the moment, than it is to get real about illicit THC products.
Absolutely. And the illicit THC products, it seems, that situation would be very easily correctable if we were on our game with federal laws. I mean, we're still, going back and forth with the federal laws. Some states are legal, some states are partially legal, some states are decriminalized. But if tomorrow the federal government came and changed cannabis from a Schedule 1 to whatever schedule, lowered it down, basically making it legal medically and recreationally across the country, then they could regulate it under FDA and other laws and pretty much more or less guarantee what people were getting. Yes?
Correct. You will always have a black market of some kind, especially you're only going to have these products legally available to those over 21. So someone's going to fuel that black market. But ultimately, you can lower the incidences of illnesses like this, and you can educate people to know that there is one particular kind of vaping and one particular kind of THC product that isn't going to potentially send you to the hospital 30 or 40 years from now. It could happen tomorrow, and people need to know that, because just telling people don't vape, people don't listen to that kind of language. They assume that they're not getting the full story, and they move on with their life.
Sure. Let me just bring in a couple of people here. We've had a lot of people in chat. Let me just read off a couple to you. Shane says, 1998 Tobacco Master Settlement Agreement. States losing huge cash because smoking rates are going down. The states made a deal with Big T. Does that make sense to you?
They made a deal with Big Tobacco, and states sold off bonds in order to get money now in anticipation of money coming in from the future during the settlement with tobacco companies. And as a result, some of these states are going to be on the hook for a lot of money because smoking has gone down at faster rates than they expected.
Wes wants to know what your thoughts are on the Master Settlement Agreement.
So the Master Settlement Agreement was a necessary evil. There was about no chance of the American government allowing the tobacco industry to go out of business. But the problem is that it made states financially dependent, at least in part, on tobacco money. And if you look at the states that are taking the harshest actions against vaping products, they are actually the states with the most to lose from upcoming bond deadlines and payments that are going to be due in the future. So it's not the number one reason why this is happening, why all these bans are happening. Ultimately, we are in the middle of a moral panic, and bad policy comes out of moral panics. But it's certainly not helping that the comptrollers, the people who are on the finance committees that are having to do budgets every year, they are noticing that their cigarette tax revenue is declining much faster than they anticipated.
Okay, yeah, so there's a little, I wouldn't say quid. We've heard this phrase recently in other areas, quid pro quo going on here, but the tobacco lobby is still as strong as it ever was, or not as strong, but just as influential?
Not as strong, definitely not as strong, but they're influential, and it's not their fault necessarily. They made this deal 20 years ago, and the states went off and sold bonds or bought bonds in order to get money now in exchange for future payments that they thought would be coming. So with or without the tobacco industry lobbying, these states took that bad deal, and they're going to have to pay for it. That's the problem.
Yeah. Tim asks, what would be good regulations? What would be good regulations for the nicotine vaping industry? That's interesting. Asking you to write the regulations before we actually have them.
So the bottom line is that standards are needed. Right now, there really are no standards. There's very lax things about ingredient submissions and not mixing in a dirty or unclean facility. those kinds of simple things, warning labels. But what we really need is for the FDA to take all the toxicological data together and decide, are there chemicals that should not be in e-liquids? Are there limits from which a chemical should not be detected in vapor when it's tested in a lab? And actually put out those regulations. And there's also a host, the Vapor Technology Association on their website has proposed a whole host of alternatives to full-blown bans, including very strict marketing controls, including bans on certain kinds of advertising, bans on having words like candy or cotton candy, those types of things on e-liquid labels, having restrictions on the kind of imagery that can be on e-liquid labels, Instagram marketing. You can go down the list of all the things that would be better than what the FDA is proposing. The European Union Tobacco Products Directive is not perfect. The nicotine limit that they set is likely too low at 2% to really make sure you get the heaviest of smokers off of cigarettes. But what they have done in the EU is 10, 20, 30 times better than what is facing America at the moment, even laying aside the flavor ban. The regulatory system that the FDA operates under is completely unworkable for new innovative harm reduction products.
Mm-hmm. Great. Quickly before we go, just a couple of more. We got a lot of people in chat, and they just wanted to express their thanks for what you do. Let's see. Oh gosh. Robin says Mary says thank you for what you do. She's very appreciative. She stopped smoking at 47. And is now a vapor, and credits it to that. Tim says 27-year ex-smoker, 4-year current vapor, no illness, feels great. Aside from losing our business due to all of this, a lot of businesses are suffering from this, are they not?
Oh yeah, we gave an estimate earlier this week of 200, a minimum of 200 businesses closing since August 1st, 2019. And honestly, I told the reporter, and thankfully she put that in there, that that's a conservative estimate. It's hard to keep track. Businesses don't often come out and post messages when they decide to shut their doors. They have better things to worry about. But we have absolutely seen businesses shutter, not just because of the bans, not just because of potential flavor bans, but because of lung illness stories scaring people into believing that it's safer to continue to smoke than it is to try a vaping product.
Yeah. Before we go, last best practices going forward. What do you, with the people here now, the people that can pass on this information within the vaping community, what do you suggest they do and look forward to help resolve this crisis?
At a single person level, we need people who are calling, emailing, and trying to meet with their local elected officials, health officials, state representatives, state senators, and your federal representatives, as well as calling the White House, calling President Trump, and giving a nice message to the volunteers that answer the phone at the White House that this is an issue that is very, very important to you. But we also need people to advocate. We need people to actually have discussions with smokers and let them know what is going on. And then for those that are really amped up, next week in Dallas, President Trump is holding a rally, one of his speeches. We are going to be holding a We Vape, We Vote rally outside all day long, leading up to the speech. You can find that on Facebook, I believe, searching We Vape, We Vote. And then November 9th, we are going to be holding a rally in Washington, D.C. And we're asking vapors, if you can, from across the country, to get to D.C. because we need to make our voices heard.
All right. Well, that's November 9th here in D.C.?
Saturday, November 9th.
Saturday, November 9th. Okay, you know what? We're going to make some time because we've never met face-to-face. I'm going to have to come down and shake your hand because what you do is of great importance and great usefulness to this vaping community. Since we've been doing these, I hear from people all the time. So you're really needed, and we thank you for your work and for your information.
Thank you. Appreciate
all right.
it.
Thank you. There he goes, Greg Conley from the American Vaping Association tonight, thanking you for all your help and your time tonight here on Now. Boy, that guy has great information. We hope to do that in the future more often. Q&A. Thank you tonight for coming in and posing your questions in chat and certainly by phone. We want to do more of that going forward, and we hope you will join us then and there. Next week, we're flipping some things back and forth. We're looking forward to a guest that I won't share with you right now. Keep looking through the week. Like us, subscribe on YouTube if you care to, but like us on Facebook. Please like us and tell your friends if you'd like to see more of this. Also, too, tell us what you'd like to see on this program. This is all yours too, just not me. We do this for you and as many people as we can. So if you have any ideas, send them to us. You'll find that either on our YouTube channel or our Facebook page. Just send it to us and we'll be glad to entertain it. So keep an eye out for that. Keep an eye out for the notification next week, and we'll let you know what's going on. Again, thank you for coming in here tonight. Thank you for joining us and spending time with us. And we hope you have a good weekend, and we'll see you next time.